Well, I will tell you, I've had over the last few years having former teenage boys. They're grown and healthy and adult males now, but they had accidents, broken bones,
Mhm.
and I will tell you, the bills coming from the hospitals, all the surprise bills, non-transparent pricing, um, you know, bills coming out of left field. It's like, oh, gee, I mean, I would thought that part was included, but imaging is separate. The doctor's fee is separate. The pathology is separate. The lab is separate. So you get all these bills. And, my wife and I are both pharmacists. We're in healthcare. So we're helping our son navigate this. And he was 18
Right.
at the time. But, and he's getting sent all these bills. He was still under our health sharing ministry. So we were responsible for his payments. But I mean, I can't imagine somebody that wasn't in healthcare making any sense of it.
Right. Well, and the other problem to add to this is we are generally at our most vulnerable when we access this chaotic, completely not. I have friends who call it the cartel.
Yeah, no, it's funny you say that.
It's like you are walking into a
Yep.
who knows what's going to happen on the other side.
Well, and you mentioned Buka before. Tell us what Buka is, and then I got a little. I can
Sure.
talk about cartel. Tell us what Buka is.
So Buka is the Blue Cross Blue Shield, which that's a whole nother story we'd have to have 2 more hours for. But Blue Cross Blue Shield, United, Cigna, Aetna, Humana. So any brand name insurance, anybody who can afford a commercial on TV, that's who you don't want to work with, because
Right.
they have the ability to afford to market to you
Yeah,
and tell you how wonderful and kind. And, I watch our local Blues plan and I just, they're really not that nice.
let's talk about what a cartel is and how that cartel happens. And you can piggyback on this. So
Okay.
the Bukas, they are in collusion with hospitals and big healthcare corporations to create a cartel to essentially screw the consumer, overcharge the consumer. And they control the prices. And the consumer does not benefit. The consumer pays higher prices. That's really what a cartel is, when the consumer really can't drive the prices lower. Now, you're going to give us away where we can. But in general, when you deal with those Bukas, that's exactly what it is. It is a cartel. The hospitals, the big clinics, they're in collusion with those companies to create a cartel.
Right. And it is really aimed at the end goal of destroying the middle class. So I'll give you an example. I remember when I was in nursing school, we used the term patient, and they instructed us to change that to client. So many, many years we would refer to the client. And then 15, 20 years ago, it transitioned to consumer. And that's when I went, oh, this is not good. Nobody wants to consume healthcare. It is not on your top 10 things of dreams and goals that you want to do with your investment, right? I don't want to spend money on healthcare. You do it out of necessity, or you do it out of your thought that you need it, because you've been very well marketed to. So to give you one example are the hips and knees replacements that we're getting. And the reality is that most often, if you blow out your knee and it's cartilage to cartilage, you can strengthen the muscles around that knee through physical therapy and do pretty well, right? Or you can get a surgery, knee replacement surgery, and the number of patients that complain of the constant pain from their knee surgery, even though they're exercising, doing everything right, that pain never seems to go away. So those are the types of decisions that we want patients to take a break. You've gotten all of this information. Now come talk to a nurse who will look at all the scientific study, which have been bought and purchased for by pharmacy, That's a whole big pharma.
Big pharma. Absolutely.
Yeah.
No,
So
absolutely.
we have to rewrite all of our scientific studies too. But needless to say, critical thinking clinicians, pharmacists, nurses, physicians, it doesn't matter what role you're in. The point is we have to be critically thinking. In other words, we have to have been trained appropriately in school so that we can critically think this through with the patient. And it's not just, I use nurses because that's who I am, but I really mean those critically thinking team members. If I don't know the answer, I'm going to call you, right? It's a matter of building a network of good, solid clinicians.